America's sexually transmitted disease problem is out of control. Sexually transmitted diseases in the U.S. are at a crisis point. On Monday, prominent public health experts and government officials raised an alarm over the ongoing annual rise in STDs. Preliminary data recently released by the Centers for Disease Control and Prevention shows that cases of syphilis, gonorrhea, and chlamydia all went up last year. This week, the CDC and the National Coalition of STD Directors are hosting their regular STD prevention conference, which occurs every 2 years and is virtual this year due to the COVID-19 pandemic. But while the conference is intended to highlight promising technological advances and initiatives, speakers have been quick to point out that the current status quo is quite dire. It is imperative that we work to rebuild, innovate, and expand STD prevention in the U.S., said Leandro Mina, director of the CDC's Division of STD Prevention, in his speech Monday, according to Associated Press reporting. In another speech, David Harvey, executive director of the National Coalition of STD Directors, went as far as to call the problem out of control. Earlier this month, the CDC released preliminary 2021 figures from its ongoing STD surveillance data. There were at least 2.5 million reported cases of chlamydia, gonorrhea, and syphilis in the U.S. during 2021, the three major STDs that doctors and local health departments are obligated to track and report. Other serious STDs such as HIV or hepatitis B are tracked as well, but their numbers are analyzed and reported elsewhere. These case counts are known to be an underestimate, since not all infections cause symptoms and many people do not get regularly tested for STDs. Instances of chlamydia in 2021, around 1.63 million cases, were slightly down from their high in 2019 but were higher than 2020's total, and cases of gonorrhea and syphilis have continued to climb year after year. There were 696,764 reported cases of gonorrhea in 2021, along with 171,074 cases of syphilis. Rates and cases of congenital syphilis passed down from mother to child in the womb have also increased, with 2,677 cases in 2021. These infections, which are entirely preventable with a timely course of antibiotics, can cause life-threatening complications. At least 139 newborns died from syphilis in 2020. Gonorrhea has its own set of unique challenges. Though infections often don't cause illness and are very rarely life-threatening, the bacteria that cause gonorrhea are rapidly gaining resistance to the few frontline antibiotics left available to treat them. And without effective drugs, gonorrhea cases will more often cause serious complications like infertility or blindness in newborns who contract the infection while in the womb. If all this isn't bad enough, 2022 has also seen the widespread global emergence of human monkeypox. Though the viral illness can spread to others through any form of prolonged contact, the current epidemic is primarily being transmitted through contact during sex, most often among men who have sex with men with multiple recent partners. The future of monkeypox is uncertain, but many experts fear that it will become a new regularly occurring STD, albeit one that can be managed with an effective vaccine and antiviral treatments. In his speech, Mina argued that there are still steps that can be taken to reduce the incidence of STDs. These include reducing the stigma associated with STDs, educating and convincing people to adopt safe sex practices like condoms, and making it easier and cheaper for people to get tested. One important way to improve testing, he added, would be the development of at-home tests, similar to those now widely available for COVID-19 or pregnancy. Dramatic rise in sexually transmitted infections. According to the Centers for Disease Control and Prevention, sexually transmitted infections, STIs, are on the rise. Here are some numbers and other info you should be aware of. In 2017, new cases of chlamydia, gonorrhea, and syphilis reached a record high of almost 2.3 million. Cases have been going up for 4 years in a row. 7 million cases of chlamydia were diagnosed in 2017, a 22% increase from 2013. Almost half of the chlamydia cases were among women aged 15 to 24 years. Chlamydia and gonorrhea often have no symptoms, but they're still damaging the reproductive systems of those who are infected. The CDC recommends that all women who are younger than 25 years should be screened every year for both chlamydia and gonorrhea, The rate of syphilis rose an alarming 76% from 2013 to 2017. Because the rates of syphilis declined so dramatically after the discovery of penicillin treatment in the 1940s, many providers don't recognize the infection. Experts speculate that the reasons behind the increase in STIs may include failing public health services and the opioid epidemic. What are sexually transmitted diseases, STDs? Sexually transmitted diseases, STDs, or sexually transmitted infections, STIs, are infections that are passed from one person to another through sexual contact. The contact is usually vaginal, oral, or anal sex. But sometimes they can spread through other intimate physical contact. This is because some STDs, like herpes and HPV, are spread by skin-to-skin contact. There are more than 20 types of STDs, including chlamydia, genital herpes, gonorrhea, HIV, AIDS, HPV, pubic lice, syphilis, trichomoniasis. What causes sexually transmitted diseases, STDs? STDs can be caused by bacteria, viruses, and parasites. Who is affected by sexually transmitted diseases, STDs? Most STDs affect both men and women, but in many cases the health problems they cause can be more severe for women. If a pregnant woman has an STD, it can cause serious health problems for the baby. What are the symptoms of sexually transmitted diseases, STDs? STDs don't always cause symptoms or may only cause mild symptoms. So it is possible to have an infection and not know it. But you can still pass it on to others. If there are symptoms, they could include unusual discharge from the penis or vagina, sores or warts on the genital area, painful or frequent urination, itching and redness in the genital area, blisters or sores in or around the mouth, abnormal vaginal odor, anal itching, soreness, or bleeding, abdominal pain, fever. How are sexually transmitted diseases, STDs, diagnosed? If you are sexually active, you should talk to your healthcare provider about your risk for STDs and whether you need to be tested. This is especially important since many STDs do not usually cause symptoms. Some STDs may be diagnosed during a physical exam or through microscopic examination of a sore or fluid swabbed from the vagina, penis, or anus. Blood tests can diagnose other types of STDs. What are the treatments for sexually transmitted diseases, STDs? Antibiotics can treat STDs caused by bacteria or parasites. There is no cure for STDs caused by viruses, but medicines can often help with the symptoms and lower your risk of spreading the infection. Correct usage of latex condoms greatly reduces, but does not completely eliminate, the risk of catching or spreading STDs. The most reliable way to avoid infection is to not have anal, vaginal, or oral sex. There are vaccines to prevent HPV and hepatitis B. Can sexually transmitted diseases, STDs, be prevented? Correct usage of latex condoms greatly reduces, but does not completely eliminate, the risk of catching or spreading STDs. If your or your partner is allergic to latex, you can use polyurethane condoms. The most reliable way to avoid infection is to not have anal, vaginal, or oral sex. 5 important reasons you need to get tested for STDs. Sexually transmitted diseases, STDs, are probably way more common than you think. In fact, there are over 20 million new cases of STDs every year. That equates to 110 million Americans living with STDs, over a third of the total U.S. population. Despite the prevalence of STDs, the American Sexual Health Association reports that only 12% of young people, who make up half of all new STD infections, have recently been tested. Multiple factors play a part in this statistic, but the fact that many STDs remain asymptomatic for years doesn't help. In fact, one study of 3 STD clinics found that 66% of positive tests came from asymptomatic individuals. Almost anyone could have an STD. The best way to prevent the spread is testing, and our experts at Apex Medical Professionals can help. Walid Elkhalili, MD, and the rest of our team work with you to perform an STD screening and do what's best for your sexual health. Dr. Elkhalili places a high priority on preventive care, wellness strategies, and health education. Even if you don't think you have an STD or are in a monogamous relationship, you should get tested at least once. Here are 5 reasons why. 1. Even virgins can contract an STD. If you're in any type of romantic relationship or have had sexual contact with someone else, you could have an STD. Many of the most common STDs can spread simply through skin-to-skin contact. HPV, syphilis, and both kinds of herpes can spread with just skin-to-skin contact. Sores are the main concern with syphilis, but cancer-causing HPV varieties and the HPV varieties that cause genital warts are easily spread through skin contact. The HSV-1 strain of herpes, which causes cold sores, can be spread through normal family contact, which is why 3.7 billion people under age 50 have it. 2. Be ready for more serious health issues down the road. HPV has a well-known connection to cervical cancer, but it can also cause cancer of the vulva, vagina, penis, or anus. Every year, about 20,000 women and 12,000 men are affected by cancers caused by HPV. If you know you have HPV, you can be on the lookout for signs of these cancers and catch them early. If you don't have the disease yet, you may still be eligible to get the vaccine. 3. Be ready for a relationship discussion. When starting a relationship with a new partner, it's important to discuss sexual history. Your partner deserves to know if you have a serious STD or if they may contract a more common STD from you. Talk to Dr. Elkhalili about getting tested for these leading common STDs. Chlamydia, gonorrhea, HIV, herpes, HPV, syphilis, trichomoniasis. Even if you currently don't have an STDs, you should still practice safe sex. 4. Build trust in monogamous relationships. STDs have a reputation for being asymptomatic, lying dormant for years, or having such mild symptoms that the infected person never feels that they need to get tested or treated. In fact, 3/4 of all women and half of all men with chlamydia have no STD symptoms. Imagine the anxiety you might experience if your partner starts to show symptoms years into your relationship. It's easy to see how accusations of cheating could come up. Instead, get tested at the start of a relationship. 5. Stay in charge of your sexual health. STD testing empowers you to take total control of your sex life. Routine testing and safe sex practices put you in the driver's seat no matter what your romantic or sexual situation is. You'll be able to make informed choices about your sexual health. We recommend STD testing for anyone who's sexually active. Dr. Elkhalili and our team at Apex Medical Professionals are ready to help. Call or request an appointment at our Fair Lawn office today or take advantage of our telemedicine services. Please contact the office at 201-797-2003 for more information.